All right, let's get into it. I will be speaking about the respiratory system. Within the respiratory system, there are two zones. Those zones are the conducting zone, which is up here, and the respiratory zone, which is more so right there, from the branches, the branched out parts. All right, so let's get back to the conducting zone. The conducting zone, which houses the nostrils right there where we breathe from, and the mouth. Of course, some people are mouth breathers. Okay. And then it goes down into the pharynx. All right. So the nostrils, the mouth, and the pharynx. All right. So that would be the upper respiratory zone. And the lower respiratory zone, which starts from the larynx, and then goes down all the way deep into the lungs. Okay, so from the larynx, it goes down the trachea. Got your windpipe here, and then where it bifurcates, where it splits, in other words, right there at the carina, some call it. And then we have the primary bronchus right there for the left and right parts of the lungs. And then the secondary bronchus. We got the secondary bronchus. And then the tertiary bronchus. All right. Down from the tertiary bronchus, it goes to whereas you're going to end up, well, there isn't any hyaline cartilage. All right. So from there, where the conducting zone is ending, that is where the respiratory zone, that's where it starts. All right. Right around this area here. Now, from the terminal bronchioles, aka the bronchioles, it goes to the the alveolar ducts. From the alveolar ducts, then the alveolar, and then, of course, gas exchange. With gas exchange, okay, so from inhaled air, we take the inhaled air, the O2, and we put it into the blood, of course, and the CO2 that is within the blood, it transfers, of course, to go to the exhale, what we exhale, the carbon dioxide. All right. Now, there's some people that may have a little issue with that. They could have the ARDS or the COPD, but that basically sums up the entire respiratory system, the conducting zone as well as the respiratory zone.